If you had to identify a transformative part of your life, what would it be? College? High school? First year in the workforce? Now, how would that change if your mental health during that time was worse? Would you be where you are today? For many, the outcome of their high school experience has a significant impact on the rest of their lives. Yet, in the United States, the mental health of high schoolers and adolescents has generally been in decline, suggesting an urgent issue that has the potential to be disastrous for the futures of this generation and the next. With greater numbers of adolescents struggling with issues such as anxiety and depression, it begs the question of what is causing this increase, and what effect will it have on students' futures. In the past decade, the number of students who have experienced negative mental health symptoms has significantly increased. In the Youth Risk Behavior Survey, conducted by the Centers for Disease Control and Prevention, the CDC identified that the number of high school students that had experienced persistent feelings of sadness, depressive symptoms, or hopelessness during the past year increased from 26.1% of students in 2009 to 36.7% of students in 2019. This increasing trend in negative symptoms was present across the mental health categories surveyed by the CDC, including considerations of and attempts of suicide. One of the immediate thoughts that comes to mind when presented with this shocking statistic is, why? To answer this, I conducted primary and secondary research, sending an anonymous survey out across my social media and reading through numerous scholarly articles. 54 individuals responded to my survey, and while my survey is likely not a completely accurate representation of the teenage population, as it was only accessible to my peers, the data shows a significant increase from published values, signaling the urgency of the mental health crisis. In my survey, I found that 89% of respondents dealt with mental health issues in high school, far above the values in the CDC survey. While the CDC survey was taken before the COVID-19 pandemic, the substantial increase I identified is likely more than just a bump due to the pandemic's psychological toll. The CDC survey asked only a few questions on mental health, and primarily focuses on depression, only one major mental health issue. Because of this, the true number impacted by mental health issues is likely higher than was found by the CDC, and while not as high nationwide as my survey, the difference is likely significant. The potential causes of this increasing trend are widely varied, with a large number of overlapping issues impacting adolescents, all of which could be affecting their mental health. In Stefan Kolashaw's Trends in Child and Adolescent Mental Health Prevalence, Outcomes, and Inequalities, similar trends are identified among adolescents, particularly a substantial increase in depression and anxiety. Kolashaw finds no definitive answers as to why this change is, but suggests that young people today sleep less and more poorly, are more likely to be overweight, and spend substantially more time engaged in screen-based activities using social media to interact with others than did previous generations. My survey agreed with Kolashaw's findings, with around half of respondents indicating that family issues, sleeping behavior, eating behavior, screen time, and/or social media contributed to their mental health issues. All of these behaviors tend to lead to worse states of mental health and could be influencing factors into declining mental health, alongside symptoms of worse mental health. In addition, mental health and academic performance are strongly correlated, such that a student's mental health can be an indicator for negative school engagement and their likelihood to drop out of high school. If you're a student with a lower socioeconomic status, you're in more trouble. Students with lower socioeconomic status are at more risk, with more factors that can cause mental health issues present in their daily lives. A study by Frank Verhulst concluded that there is solid evidence that low socioeconomic status is associated with higher risk of mental health problems in children and adolescents. Verhulst later identifies three main areas that contribute to this higher risk compared to adolescents with higher socioeconomic status: individual, relational, and institutional. Individual factors include parental mental health and home environment, both physical and supportive. Relational factors include parenting practices, parental stress, and harsh discipline or lack of parental control. Institutional factors include quality of schools, neighborhood disadvantages, parental job instability, and access to health care. In my survey, monetary issues are cited as a contributing factor to mental health by 23% of respondents, suggesting that socioeconomic status alone can impact adolescent mental health. Along with all these factors and the struggles that can come with low socioeconomic status, this greater risk for mental health problems has the potential to cause low socioeconomic status students to struggle in school, making it all the more difficult for them to improve their socioeconomic status. One of the most complicating issues is the correlation between mental health status and academic success. Each affects the other. As written by Shannon M. Soldo, The relationship between academic and mental health functioning is bidirectional, and changes in one domain can predict changes in the other. A student doing poorly on a test could lower their self-esteem and result in worse engagement, creating a self-fulfilling prophecy of struggle and falling down a mental health spiral. This was the case for many respondents of my survey. 78% said that mental health impacted their academics, and school-related factors were 3 of the top 4 factors cited by respondents as contributing to their mental health issues. From one respondent, decreased mental health led to decreased performance in academics despite the increased work put in. This resulted in further decreased mental health. And from another, I never felt like I was good enough, no matter how good I was doing, and as a result, I would avoid doing work. If a student already has poor mental health, as an increasing number do, they tend to do worse in school, and this can potentially lead to dropping out or a change in future plans. In an article by Sian Bowman, the two are directly connected. The Australian National Survey of Mental Health and Wellbeing data found that depression and anxiety were significantly associated with disruption to the completion of Year 10 and high school dropout. In fact, 55% of respondents to my survey said that their mental health impacted their choice of path after high school. While potentially not as significant as dropping out, negative mental health can detract from a student's post-high school plans, potentially derailing their career aspirations. From one respondent, since I struggled so much in high school, it was a challenge to get certain scholarships and stuff that I definitely could have gotten, which made certain schools unaffordable or unrealistic. More students are struggling with mental health issues, and this means that more may be at risk of dropping out or having their future plans derailed by situations out of their control. With the situation presented as a whole, it is clear that teenage mental health is a problem that must be addressed now. This problem is not going away, and the pandemic has only amplified it. If left unchecked, the mental health crisis could have disastrous consequences for generations down the line, causing permanent health consequences like lifelong mental illness. The issue is, how do we address it? Action and research. In Bowman's study, it was identified that school-based mental health services integrated into the school life could alleviate many barriers to accessing treatment for young people and promote early identification and intervention. Adding more personnel to schools that are trained to help students struggling with or at risk for mental health issues provides an immediate action that can be taken to safeguard students. We already know a direct way to help with negative mental health, we simply need to implement it. However, this solution would be costly to implement, as it would require a significant increase in staffing for schools nationwide, many of which already struggle with funding as is. This is where further research comes in. Primarily, we need to take better assessment of where teenage mental health is at by surveying specifically for mental health indicators and potential causes of mental health issues, as the current CDC survey does not ask about enough. By identifying more concrete causes of negative mental health in teenagers, systemic solutions can be developed to remedy or remove such causes. In particular, educational reform may play a significant role, as the form of schooling itself has the bidirectional relationship with mental health. From the results of my survey, this seems to be the most effective change. By making school and the way we teach an environment that promotes and is sympathetic to mental health, we can eliminate one of the largest stressors on many high schoolers. To get these changes to happen, discussion needs to be brought to more people in power, for only then can we begin to tackle the teenage mental health crisis.